If you get knee pain just here after doing your sports, most people will tell you it's growing pains, but it could actually be something called Sinding-Larsen-Johansson disease. And if you ignore this, it could put you on the sidelines for a lot longer than you wish. Welcome to the Physio channel. My name's Daniel Lawrence. In this video, we're talking about Sinding-Larsen-Johansson disease. It's not actually a disease, although it's often called that on the internet and in textbooks. So it's not a disease, so that's one less thing to worry about. Now, the reason it occurs is in young active teenagers, this point where the patellar tendon attaches to the kneecap, I'll put a diagram here, is still a soft growth plate. It's not yet hardened into full adult bone. So the next thing you'd be pleased to hear is that this condition will clear up into your late teens as you become an adult and those softer growth plates harden up. However, it is important to manage it when it is painful so that it doesn't become too painful and stop you from doing your sports and activities, and also so that you don't do any unnecessary damage by trying to ignore the pain. So in this video, I'm going to share some important advice and tell you what you should be doing. It's basically your knee telling you that you're doing too much running and jumping, and you need to cut back on those things just for a short while to let that growth plate recover. Next, let's have a little look at how we identify this knee condition. Let's call it SLJ for short. So the pain is at the bottom of the kneecap. And if you just run your fingers down there and just over the end of the kneecap, you'll probably find that that's painful. So that's an indication that you may have this condition. As I mentioned, it's often caused by running and jumping activities and sports. So if you get the pain or it gets worse after doing those activities, again, it's an indication that it may be SLJ. Now, there's a couple of important things to tell you. Firstly, if the pain is lower down on the top of the shin, where that lumpy bit is, that's a different condition. Again, it affects the growth plate, but it's a different condition in a different location, and that's called Osgood-Schlatters. And I'll put a link in the description if you're watching this on YouTube, and I'll also put a video at the end on Osgood-Schlatters. So if you've got the pain there, or the pain there as well, then you may wish to watch the Osgood-Schlatters video, which you'll probably find very helpful. Now, the next thing I need to tell you about is similar, but way more serious, and that's called a patellar sleeve fracture. This is how you tell the difference. With SLJ, the pain onset is often gradual, whereas with a patellar sleeve fracture, the pain onset is sudden and usually happens after a fall or a high impact. With the patellar sleeve fracture, you can expect more pain and swelling, and also you'll have difficulty or you won't be able to fully straighten the knee with a patellar sleeve fracture. If you have reason to believe you have a patellar sleeve fracture, that is a medical emergency and you should get some medical attention straight away. Overall, this video is for education purposes and should not replace medical advice. So returning back to the Sinding-Larsen-Johansson condition, or SLJ for short, this is how you can help recovery. You don't need to stop all sports, you just need to cut back on jumping and sprinting activities by what I recommend 60% initially. And you can then replace those activities with lower impact things like walking, cycling, swimming, and rowing. You may also be able to start some strength training activities because this is still low impact. So you'd start with some static exercises like static squats or static lunges, and holding these for around 30 seconds. But at this point, I'd recommend getting some personal guidance from a rehab professional so they can monitor your symptoms and progress. Once you can squat, run and jump without pain, it's a good sign that you're ready to get back to sport. And most people get back to full sporting participation after a few months. So if you have that pain under your knee, don't just ignore it, make those simple adjustments and you'll be able to get back to sport a lot faster. Now I'm going to show you some other ways to reduce the pain. Patients with this condition have told me that these patellar tendon straps can help reduce the pain. Taping the knee can also help, and I'll show you a quick application here. Start with the knee bent to about 90 degrees, then take a piece of tape. Here I'm using kinesiology tape. This is rock tape. I'll put a link in the description for you, but you can use some other types of rock tape as well. Place the bottom piece of tape over the top of the shin, and then stretch the tape by about 50% over the top of the kneecap, and then make sure there's no stretch on that last piece of tape before you peel away the backing paper. Once it's there, make sure you've given it a good rub to make sure it's firmly stuck down onto the skin. And then what you can do is take a second piece of tape and place that across the front of the knee. So peel away the backing paper so that you've got the middle of the tape exposed and you can stretch it. Place that over the bottom of the knee, over that painful area. And then to avoid going around the back of the knee, gently pull the tape up so that it comes over the sides of your thigh, and stick that down with no stretch on the end. Now it's important to note that the tape is there to help manage the pain and won't help the condition to clear up faster. So don't use the tape to simply mask the pain and carry on with your running and jumping activities without actually reducing the volume by 60% as we discussed. The tape is just there for some simple non-medicated pain management. So I hope it helps, and if any of the strategies that I show you today particularly work well, please put a comment below and let the other viewers know what's working for you. Here's the next thing you can do, a hamstring stretch. Bring your leg up, use a piece of rope or an exercise band if you have one. Straighten that knee and get a good stretch on the back of the leg. Relax your breathing and hold that for 30 seconds. If required, repeat that on both sides. The next stretch is the one for your quadriceps. Now these are the ones which go down through the kneecap and pull on that painful point. So this is perhaps the most important stretch. This can be done standing up or lying on your side. So whilst we're here, I'll show you that one. So lie on your side, make yourself comfortable. Bring your leg up so you can reach your lower leg, and then bring your heel towards your bum so that your thigh is in line with the rest of your body. So your thigh is in line with your spine. Pull your heel towards your bum. You've probably done this stretch lots before, but when you do that, you'll feel a good stretch through your thigh, through your quadriceps. Now, if that's painful, then don't do that. Ease off and stop doing that stretch. But instead of pulling your heel directly to your bum, you could try taking your knee back so that you're extending your hip a bit more. And if you do that, you may be able to get the stretch on the front without getting the pain in your knee. Once again, if this does cause an increase in knee pain, then stop doing it and get some personal advice on other stretches and exercises you can do. Before you go, there's some other helpful information in the description below this video, and it'd be great if you could share this with anybody else you know who may be suffering from this type of knee pain. You've been watching the Physio channel. My name's Daniel Lawrence. Thanks for watching.